Yes, ma'am, you can start now.
Very good evening, one and all. At the outset, happy Holi to all the viewers on Facebook and YouTube. This is a live session on World Obesity Day, 4th March 2026. I welcome one and all on behalf of Endocrine Committee FOXY, FOXY NCD Committee, and FOXY Public Awareness Committee. It is Obesity is one of the growing health problem. It is a chronic disease reversible from the WHO as well as the American Society of Physicians. So here I am welcoming Dr. Chaitanya Ganapule, Chairperson, Foxy Endocrine Society, to address the gathering and welcome all the viewers. Chaitanya sir, I welcome you onto the dais.
Thank you, Manjula. As a chairperson of the Foxy Endocrinology Committee, I would like to welcome all the viewers today for this very important awareness program on obesity. The name of it itself suggests what's the scale of this problem. Beyond the scale, obesity and women's health. We have organized this program under the auspices of Foxy, under the leadership of Dr. Bhaskar Pal as the president of Foxy, Dr. Suvarna Khadilkar as the secretary general for Foxy, and the three committees that have come together for this program. That's the endocrinology committee chaired by me, an NCD committee chaired by Dr. Kanchan Sharma, and the public awareness committee chaired by Dr. Monica Umbardan. So going ahead, I would like to have an address from our beloved president, Dr. Bhaskar Pal. Over to you, sir. I would like you to address us
Thank you.
all. Thank you.
Thank you. Thank you, Chaitanya. As already outlined, today is the World Obesity Day, and we are having this program to observe that and also to raise awareness among healthcare practitioners and among the general public about obesity. Obesity is already a pandemic in the West, and gradually we seem to be catching up. In obstetrics and gynecology, obesity primarily has four implications. Among the young women with polycystic ovarian syndrome, uh, about more than 50% are in the group who have an obese PCOS, and obesity is a problem there. We have a problem with obesity and reproduction, and quite a significant percentage of patients presenting with fertility issues have obesity. The third issue is that obesity is also common in midlife, and it is getting commoner day by day because of various reasons, and globalization is one of them. And the fourth issue is that when we are dealing with obese women, not only they have multiple comorbidities, but if we have to operate on them, be it a cesarean section or a gynecological surgery, it has got major implications on their on the perioperative complications and outcome. The cornerstone of managing obesity is lifestyle management, which is essentially diet and exercise. Obesity has got a significant psychological impact, and that many a time we have to take a psychological counseling along with that and need to involve a dietitian and give them advice about exercise. Having said that, going forward, there has been an immense explosion of scientific material in managing obesity. So there would be a section of patients for whom there will be pharmacotherapy would be useful. There would be a group of patients for whom a bariatric surgery or weight loss surgery would be useful. So to know about the impact of the obesity, to know about what are the management options for obesity, and essentially to raise an awareness, we have an excellent panel today, which represents the entire gamut of obesity management. We have Dr. Parag Bini, our own Dr. Parag Biniwale as the gynecologist on the panel. We have Dr. Srirang Godbole, the endocrinologist, Dr. Neeraj Rayate, who's an uh, obesity surgeon, Ms. Ramya Kannan, who's a psychologist, and Ms. Avanti Damle, who's a nutritionist. I would like to thank My Foxy colleagues, Dr. Suvarna Khadilkar, Secretary General, Dr. Minu Agarwal, Vice President, Dr. Vidya Thovi, Vice President, for being here. And the entire program has been stitched together by three committees of Foxy, the Endocrinology Committee led by Dr. Chaitanya Ganpule, the NCD Committee led by Dr. Kanchan Sharma, and Dr. Manika Umbardhan, who leads the Public Awareness Committee. And I also take this opportunity to thank Dr. Manjula Patil and Dr. Jigyasa from the Endocrinology Committee for anchoring this program. Back to you. And I think this World Obesity, the whole purpose of having an Obesity Day is to raise awareness, and we will do our bit today. Thank you.
Thank you so much, sir, for that kind words and accepting our invitation to be the chief guest for today's program. Moving forward, I would like to welcome our second chief guest for today, Dr. Suvarna Khadilkar. She is the Secretary General for Foxy, and I would like her to address us. Over to you, madam. Okay, so I
Okay,
think
I'm here. Yeah, sorry,
Yes.
I was muted. I'm sorry I can't talk much, but I first of all I want to congratulate the three committees under the leadership of Dr. Bhaskar Pal for having this excellent awareness program on obesity. At the same time, I feel terrible that we are seeing the obesity epidemic that is malnutrition, and today we are seeing the obesity epidemic that is in both rural as well as urban areas. And we programs like this we have to organize, and we all are aware about the impact of obesity on women's health. I think Dr. Bhaskar already covered all those, and therefore it is important that all the women and how the globalization has affected the lifestyle, and lifestyle management is the treatment, as well as I will say lifestyle changes is the cause for having such high obesity incidence across the country. And but I think as in the medical fields we are always having, if there is a problem we always have a solution. So over the years we have developed medical and surgical aspects of managing obesity apart from lifestyle various therapies. So, and also apart from the cosmetic concerns and body shaming, I think obese girls, even from young age, they do suffer all the metabolic disorders like dyslipidemia, then diabetes and hypertension, and so many other cancer is also higher in obese patients. I think it's not that, so all types of non-communicable diseases also common in obese women. And last but not the least, we have to understand the concept of thin fat Indians, where many of our PCOS girls who are thin, they do have a lot of visceral obesity that alters their metabolic profile. So I think we all must understand this, and general girls and women must know how to keep their weight in check. And I can see my dear younger colleague Jigyasa who is there. I think you can do a lot in your age, girls, to spread the awareness. And I can see all my colleagues, Parag, Dr. Kanan, Dr. Chaitanya, Dr. Monica, Dr. Manjula, Vidya, Minu, and everyone, Avanti, who is, I think, our nutritionist. So I think all the experts like Dr. Srirang Godbole and other experts who already joined. I think bariatric surgeon is here. So I think let's hope that this helps everyone, all those who attend, both healthcare professionals as well as the women. So let's fight this epidemic obesity. Thank you.
thank you, Suvarna madam, for those kind words. Uh, Moving on, let's have address from our Vice President, Dr. Vidya Toby madam. She is the Vice President in charge for my committee, that's the Endocrinology Committee, and NCD Committee headed by, chaired by Dr. Kanchan Sharma. Over to you, Vidya madam.
Thank you, Dr. Chaitanya, and it is a really pleasure to be on this platform. I must congratulate all these committees and Foxy, our Dr. Bhaskar Pal, Dr. Suvarna, and others to bring this very burning issue on the platform and as well as on Facebook Live. Many of you must be having many queries and they can be answered through this platform. So today is an Obesity Awareness Day. Let us remember that health is a foundation on which strong families and strong nations are built. And obesity is not about weight. It also influences, as Dr. Bhaskar Pal and Dr. Suvarna has mentioned, fertility, pregnancy, and what we are worried about is the lifelong health of next generation. So non-communicable diseases. So as doctors and caregivers, we have the power to guide these women and families towards healthier choices. So small, simple lifestyle changes today can prevent major diseases tomorrow. And together, let us inspire this movement for healthier women and healthier India. If you see the theme for 2026 World Obesity Day is 8 billion reasons to act on obesity. So it emphasizes the need for the collective action to address these growing health concerns. So 4 M's also they have defined as key areas of comprehensive assessment for the management like metabolic. We have our endocrinologist here, diabetes, heart disease, mechanical also because of overweight, joint pain, maybe there may be apnea, and mental because they are obese and they have depression and emotional eating also. And all these requires various financial barriers. So this is very important issue sometimes to treat whenever obese patients have come. So many of them they are lured by various advertisements and they will not have any scientific answers. So this platform really I must congratulate the 3 committee chairs, Dr. Chaitanya, Dr. Kanchan, as well as Dr. Monica Umbardan. They have taken a lot of efforts to bring these eminent speakers on this platform. I congratulate them and I will be there till last and I will definitely listen to all the stalwarts. We have Dr. Parag Biniwale, who is a very expert gynecologist with us. So may you can put your queries, you can in the chat box. There are other people also to support you for any queries. So thank you very much to invite me on this platform and say some few words. Thank you very much.
Thank you very much,
Thank
madam,
you.
for your
Thank you,
words of
Vidya madam.
wisdom.
Thank you.
We would also like to hear from Dr. Meenu Agarwal, who is
No,
the Vice President for the Public
Yes.
Awareness Committee. Over to you, Meenu madam.
Thank you, Chaitanya. I'll just switch off my video because I'm in a low net internet zone, but I'm
Even.
talking. Okay. So yes, so one moment. So thank you very much. And Dr. Bhaskar Pal, President, Dr. Vidya Thobi Madam, the Vice President, and I can see a lot of people, Dr. Chaitanya Ganpule, very nice activity, Dr. Monica, very nice activity. I can see Dr. Kanchan Sharma here. I can see Dr. Manjula Patil, Dr. Shriran Godbole sir. Sir is very well known endocrinologist from Pune, and Dr. Ramya Kaman and Dr. Avanti and Dr. Jigyasa. I can see over here. So thank you very much. And Parag is also there. Again, a very eloquent speaker and very nice with the public. He can speak very well to the public. So this is a good program on obesity, a public program. And I attended one obesity program which was chaired by the international head of the department from Atlanta. And his one line I still remember. He says, do anything, whether it is diet, whether it is exercise, whether it is medication, whether it is whatever you have been doing, and it is helping you to lose weight, just continue with it. Don't stop it. Because if you stop it, it will come back. So whatever is helping you, just continue with that. And then the weight will be under control. So thank you very much. And Dr. Monica, Dr. Chaitanya, all the best
thank
for
you.
this public program. Very good initiative under
Thank you very
the
much.
presidency of Dr. Bhaskar Pal. Thank you so much. Thank you.
Thank you, ma'am, for the kind words.
Thank you, Dr. Meenu madam, for those words. And let's move on with the program now. So we
Dr.
have
Parag.
3 lovely ladies who are going to conduct this program. Dr. Manjula Patil, who is the National Coordinator for Endocrinology Committee, Dr. Jigyasa Dingra, she's a member for our Endocrinology Committee, and our Dr. Monica Umbardan, who is the chairperson for the Public Awareness Committee. So I would like Manjula to take over from here, and for the next 1.5 hours almost, we are going to have a very lively discussion with all the stalwarts, as mentioned by all. Manjula, you can introduce your panel for today and carry on with the program. Over to you, Dr. Manjula.
Thank you, Chaitanya sir. It is my opportunity that I thank you and all of you for giving me to conducting this program along with the NCD committee as well as Public Awareness Committee. And we have today in our panel various specialty speakers, obstetricians and gynecologists, endocrinologists, psychologists, nutritionists, and obesity surgeon. We have endocrinologist Dr. Srirang Godbole, Dr. Parag Biniwale from Pune, Dr. Neeraj Raitde, obesity surgeon, Dr. Ashwini Damle, Dr. Neha Gupta, Dr. Avanti Damle, nutritionist, and Ramya Kannan, psychologist. And with this introduction, I am handing over this to Dr. Jigyasa and Dr. Monica to conduct the further sessions on the question and answers. Over to Dr. Monica.
Thank you, Manjula ma'am. As we all know that obesity is not a cosmetic issue. It's a chronic medical condition where you have an excess body fat which begins to disturb your normal body functioning. Now, even a modest increase in the belly fat can significantly increase your health risk. What makes this issue even more important is that it affects every stage of life, right from childhood till old age. So it begins in the childhood, and that is why let's begin with our first session, which is in children and teenage obesity. This brings in experts from endocrinology, obstetric, nutrition, bariatric surgery, and psychology just because it is not one factor and it cannot be solved by one solution. Being biological, hormonal, lifestyle related, and emotional. And our goal for today's program is not to blame anyone, but is to create awareness, empower them, and the prevention of obesity. So let's start an important conversation. Srirang sir, are you seeing more and more of kids having obesity? And what do you think is the reason behind the changing pattern that you see today?
Good evening, and first of all, thanks to Foxy for giving me this opportunity. Yes, we are seeing a lot of childhood obesity nowadays, and this is not simply because of one reason, but there are several interconnected reasons which have to do with genetics, environment, lifestyle, behavior. So clearly, lifestyle has changed, and children today are less likely to be physically active. Outdoor play or outdoor games have reduced. Screen time has increased for various reasons. Dietary patterns have changed. There is a lot of easily available packaged foods, processed foods, sugary beverages, and even our traditional diets actually are becoming more and more refined. We tend to use more of maida and sugar and ghee and fat and all sorts of things. There is also this increased prevalence of urbanization and even academic pressure. Nowadays parents prioritize studies over play, and therefore children more likely are going to sleep late, and late night sleeping very often induces increased appetite. It induces increased binging. Also, let us not forget that in India, children as well as adults are more prone to getting, central obesity, that is obesity around the tummy, even for relatively normal weight on the scale. And finally, also, let us not discount the importance of parental obesity, because if parents are obese, then their children are more likely to follow the same dietary patterns and the eating habits. So all these conditions and many more also have contributed to the increased prevalence of childhood obesity in India?
Uh, Ma'am, to continue with the same question, our next question would be to Dr. Ramya Kanan. Ma'am, what is the impact of increased screen time, study stress, which sir has already spoken about, and emotional eating? Do you feel that the children of today need a little more counseling on these aspects?
Yeah, thank you so much for the opportunity and good evening, all. Yes, screen time has definitely impacted the eating patterns because the fullness cues that the mind registers that gets missed, and because we are constantly being distracted by the screens, and so we are not paying attention to the food that's right in front of us. So we tend to naturally overeat, and more dangerously, I think it creates associative conditioning, which is the kids start associating screens to food. Screens become equivalent to snacks. So food then does not become initiated by body hunger, but rather every time you sit in front of a screen, then you would want to snack on something. Yeah, so that leads to obesity as well. And emotional eating, yes, it's learned as a coping mechanism where we are not able to regulate the emotions of the child, and most often we see parents, अगर अब बच्चा कुछ रो रहा है या कहीं कुछ लग गया तो immediately we say, okay, रोना बंद करो, I'll give you a treat, I'll give you a chocolate. Or when a kid is upset, exams अच्छा नहीं हुआ तो चलो, I'll take you to the ice cream parlor. कोई नहीं बोलते कि as a reward nobody offers an apple to a child, right? It's always the junk food that's offered as treats and rewards. So if we want to prevent obesity in children, as doctor rightly pointed out, it should start as a family habit, and the culture of healthy eating should start from the parents so that it automatically gets transferred to the children. And if we want to prevent obesity in children, I think we must also start treating emotional regulation as seriously as we talk about nutrition.
Ma'am, how should parents talk about weight shaming? Because children are bullied in the school regarding their weight. So if the child comes home with the same guilt that he is overweight, and so how should a parent counsel this child so that the child does not go into depression or need help for that reason at least?
Yeah, that's a very valid question, because on one side we want the children to be healthy, and we also do not want to shame the child for their body weight, right? So I think we have to make the whole enterprise about not about weight but about health. Healthy food and healthy habits are going to make us stronger, are going to make us more fitter. It's going to give you more energy, and therefore it's going to help you manage your moods better. In my own case, I have a daughter, and we noted that every time when she skips her tennis classes, there was some kind of a mood swings that was happening. She was either getting very angry or she was having meltdowns. So we sat with her and we kind of analyzed how not being able to play is actually impacting her mood swings. So if you can make it more about, as parents, if we can make it more about the good things that good health brings, it's going to make you stronger. You're going to have more energy to do the good things that you wanted to do in life. It's not to do about appearances per se, but it's about the benefits that we get out of good health. So if we can change that narrative, then it's going to definitely help us deal with our kids better.
Thank you. Srirang sir, the next question is for you. How would a parent pick up the early signs of insulin resistance in a child?
So let us first understand that insulin is the hormone that promotes the entry of glucose from the blood into the cells, because finally sugar or glucose is the fuel of the body. So if insulin doesn't work well, the sugar cannot move from the blood into the cells. And therefore, what is called as insulin resistance simply means that the cells are not responding to normal action of insulin. And that, has some markers. Parents can make out that their child is getting insulin resistant. Mainly, the waistline starts increasing rather than something that happens on the scale. It is the fat around the waist or the belly fat which starts increasing. And one of the easy markers of insulin resistance is darkening of the skin in the folds, especially the nape of the neck, in the armpits, and in the groins, or in other folds of the body. So this is sometimes dismissed by parents as lack of cleanliness. And that is not so. This is simply that insulin has now started to work lesser and lesser in the body. Now, in a girl who is of a growing age, this sometimes also is associated with irregular periods. It is sometimes associated with unwanted male pattern hair on the face or chest or abdomen, or it can manifest as increased oiliness of the skin and acne. And sometimes insulin resistance can lead to fatigue. And sometimes, even nowadays in adolescents and youngsters, we are getting, borderline raised blood pressure also. So child may complain of headaches as well. So you have to be alive as a parent to all these early warning symptoms and signs of insulin resistance, pick them up at the earliest and consult the specialist for the same.
Thank you, sir. Parag sir, the next question is, does maternal obesity increase the risk of childhood obesity?
Yeah, Monica, just to answer this very, very simply, the answer is yes. So, whenever any woman who's overweight or obese who comes to us with a pregnancy, we have to counsel her. Srirang and Ramya have already told the counseling points, but then we also have to reiterate that the mother would be responsible for the programming of the child. Right, so anyway, she's going to pass on some genes which probably will make the child prone for obesity. But if the mother is not careful enough during pregnancy and even after birth of the baby is likely to be, baby is going to grow obese. One very important thing which all obstetricians have to change is the mindset of the patient and the relatives. All of you will agree that when a baby weighing 4 kgs or 4.5 kgs born, the baby is labeled as healthy. But then we have to make them aware that these babies most of the times are macrosomic and then they are obese. And when they grow up, they are going to face challenges of obesity and so many issues which are likely to be associated with it. So just to simple message for all women who are pregnant, if you are obese, mind well, you are going to pass it on to your baby, and the baby is going to be obese if you are not very careful.
So rightly put forward is not eating for two, but eating right is more important during pregnancy.
Absolutely.
Now, our next question is to Ms. Avanti, ma'am. Ma'am, taking into consideration that we are into the childhood and teenage section, what are the good school habits that you would recommend for children and healthy snacking options or tiffin box options that you can give mothers, which could be prepared easily so that junk food goes in less?
Okay, so good evening, everyone. First thing is, I feel that sitting together with family and planning a weekly menu, that really helps, because then that will create a family bond. And if parents take kids for grocery shopping or vegetable shopping or any kind of fruit shopping, so even this involvement will help them ki, okay, we have to choose the right food for ourselves, and everyone is choosing something good for them. So I think this agenda we should come up as, and again Rama ma'am also said ki there are like we always associate sugary foods with some celebrations, and we always associate any punishment for excess, like in Marathi we say utha basha kada. It is the best form of Scots, but unfortunately our mind is conditioned ki if we are under any kind of guilt, you have to come up with like daha utha basha kada किंवा groundला राउंड मारा. So we have to change this perspective. We have to make sure that going out with family or spending time together, that should include some kind of physical activity, like you can go for swim together or you can play a sport where there will be involvement of physical activity. So these two things they are very essential, because kids should know okay, what kind of foods they want to consume in a next week, and what are their choices. So suppose they want to eat something which is kind of a junk, so 80-20 principle will really help them to choose a good healthy food which is going to give them good nourishment. But 20 times they will cheat, but they will cheat sensibly, they'll be more mindful. So suppose, like, all of the kids, they like mayonnaise. So I would like to give this example because all the kids, they love mayonnaise and they definitely ask for mayonnaise all the time. So hunkered is the best option. If you prepare hunkered at home, it is, in Marathi we say chakka. So you can add mustard seeds and pepper powder and oregano. You can flavor it the way you want, and you can use that as a base for your sandwich preparations or any roll, or no, any kind of kind uh, any kind of basically wraps, where you can add some protein, like in the form of tofu or paneer or egg white or chicken, along with this curd ka mayonnaise. So even they'll be happy, and they will eat it, because all the time, if we talk about eating healthy, they get irritated. And I would like to add one more thing here, like birthday celebrations. We always think that birthday celebration is about cutting cake, but if we can, as a parent, if we can take a lead and we start cutting some other, like nowadays you will get fruit cakes, okay, like watermelon, pineapple together. So we should come up with these ideas, so automatically even kids will definitely opt for these options. We have to change the perception of eating healthy, because if they're under pressure कि नहीं अच्छा ही खाना है all the time, then they say कि everybody else is going out and having burger or pizza, and you are always saying कि नहीं घर का ही खाना है. So make a give them good excuse कि okay, 80 times you are eating healthy, so 20 times you can cheat, and but you have to be mindful, and you cannot cheat for full meal. Like there are meal packages where you will get a cold drink, then you will get a wedges or finger chips and a burger. So they cannot have three things together. They have to choose one product. So again, portion size control is the key. So they'll understand that too.
Rightly put in, ma'am. So kids will do what you do. So we have to start with ourselves first, is what message I get from what you wanted to put in, and give them one cheat day in a week. Let the rest of the times let them eat healthy. Start with a salad, is or a fiber, whatever you feel is what your message would be. Shriran sir, do you recommend any investigations if the parent comes to you with nocturnal anuresis or obesity or signs of insulin resistance? What are the key investigations that you would advise?
So besides the routine blood work, which includes the hemoglobin, we are in particular interested in the liver function tests, because finally there is only so much that the body can store, in terms of fat. Once that storage capacity is exceeded, fat starts getting deposited in locations where it ought not to be. For example, around the organs in the body, and in particular inside the liver, which is nowadays, commonly called as fatty liver. And that can alter the liver function tests. And that, in fact, is a risk factor not just for liver disease, but in fact for heart disease. And I was talking about insulin resistance, and the consequences of insulin resistance are, of course, well known. One is diabetes, but you need not have always frank diabetes. You can have an intermediate stage, or what we may call as pre-diabetes. You can also have abnormal profile of the blood fats, or what is called as cholesterol and triglycerides. So those things can start getting abnormal. Various other cardiac risk factors also can get abnormal in such individuals. For example, there is an amino acid called homocysteine that can start increasing in people who are overweight. And then, of course, there can be hormonal disturbances in women, specifically hormones that are necessary for ovulation and regularity of the cycles, or, as I was mentioning, unwanted hair. So some of those hormones, which are commonly called androgens or the so-called male hormones, they might get altered in women who are obese. And in men, likewise, you can get a reduction in the so-called male hormone or testosterone. So you can have a whole lot of hormonal issues which are associated with obesity. So you have to examine the child in detail, or the index patient. And I always make it a point to also look at the parents, because they share their genes with them. And if the parents have a particular disease which could be inherited, then I would also screen the child for that particular disease as well. You have to then again rule out certain rare hormonal causes of obesity as well, because most of the time, of course, you may not find a specific cause for obesity, but there are a few very specific endocrine causes of obesity which also needs investigation. You also need to check the thyroid function. So several tests may have to be done in a given child who comes with obesity.
Thank you, Chair, for an elaborate information. And we always say that family who eats together stays together. So now we should start saying the family who eats together and healthy will become healthy altogether and will be much more happier. So early interventions will help us to prevent adult diseases. And now let's move on to young adulthood and fertility. This segment will be taken by Dr. Jigyasa Devi.
Thank you, ma'am.
Dr. Jigyasa, over to you.
Thank you,
Please let
ma'am.
us maintain the timings.
Thank you,
Already
ma'am.
we are 5:43.
Thank you, ma'am, and good evening to one and all. Thank you for that insightful discussion on childhood health. We now move on to young adulthood, a stage filled with dreams, careers, and for many, the hope of starting the family. But what happens when weight becomes a silent barrier to the fertility? Today, many couples struggling with infertility don't realize that obesity may be playing a central role in both women and men. Let's unpack this with science, sensitivity, and solutions. I start the session with Dr. Parag sir. We often hear that obesity affects ovulation. Can you explain in simple terms how does excess weight actually disrupt the woman's ability to conceive?
Okay, now all of us will agree that a lot of women these days have polycystic ovaries, and polycystic ovaries are associated with obesity in most of them. And typically, this will have an impact on the egg formation process. So, either there is something called oligo-ovulation, so the egg formation is delayed, or the egg formation doesn't take place at all. And then that is a big challenge when women are trying to become pregnant because of the poor egg formation process itself, it is difficult for them to become pregnant. Uh, so whenever such women come to us for treatment, the first thing that we have to reiterate that they have to work. Of course, lifestyle modification is something which is extremely important. And if they lose about 5 to 10% of their weight, it is possible that the egg formation process will improve, and there could be a chance that they may become pregnant on their own. So, this is the first simple intervention that we should talk to them about.
And sir, how does it impact the miscarriage rates and IVF success?
Right. So generally, it is observed that the quality of the egg is poor in women who are obese. So when there is a conception with such poor quality eggs, obviously in about 30% of women there would be a miscarriage, and this typically happens in the first 3 months of pregnancy. Similarly, if she is undergoing treatment for IVF, again, the quality of the egg really matters, and the success rate also is very low as far as infertility treatment is concerned. So everywhere it is important that they focus on their health, they focus on reducing weight, and then go ahead with any treatment. May it be a simple basic infertility treatment or even something like in vitro fertilization.
So obesity doesn't just delay pregnancy, it can affect the entire reproductive journey. I like
Absolutely.
I'll like to ask my next question to Dr. Srirang sir. From hormonal perspective, what is happening inside the body? And how do insulin resistance and conditions like PCOS connect obesity to infertility?
So I was just saying that insulin resistance implies that the body cells are not responding to insulin. So what does the body do to compensate for that? The body starts producing more insulin. So the insulin levels start going up. But insulin is not a hormone that simply works on blood glucose. It also works on other cells. So for example, high insulin levels will act on those cells in the ovaries which produce the so-called male hormones or androgens. And therefore, these cells then respond to the high insulin levels by producing more of androgens, which is then responsible for excess body hair or acne or hirsutism. The other thing that happens is high insulin levels reduce certain proteins in the body which bind to these androgens. So androgens exist in two compartments, one of which is bound to proteins and one of which remains free or unbound. And it is this free fraction or the unbound fraction which is actually hormonally active. So when there is high insulin levels, the protein bound fraction of the androgen goes down, and relatively speaking, the unbound or the metabolically active fraction of testosterone or androgens keeps on going up. So now you have a situation where the total androgens have increased, and also that fraction of those androgens which are hormonally more active, that also increases in proportion. And that is a result why such women have, as was mentioned, irregular cycles, abnormal ovulation or absent ovulation. They could have unwanted facial or body hair. They could have acne, oiliness of the skin, and so on.
So weight gain worsens hormones and hormonal imbalance worsens weight gain. A vicious cycle goes on. Now, my next question is to Avanti madam. We often tell patients just lose 5 to 10% of your weight and come back for the infertility treatment. But practically speaking, how realistic is that? And what is the safe, sustainable way to for couples to conceive to approach of weight loss and without extreme dieting?
Okay. So whenever we are thinking about weight loss, we have to change the perspective. Rather than going for weight loss, we should focus more on fat loss. So meanwhile, we have to build more muscles so your calorie burning capacity goes up, your insulin resistance goes down. And while doing changes in daily intake, the focus should be eating good fat. Otherwise, usually people opt for only fiber rich food, they opt for only salads and soups, and then they think they can lose weight, but actually it is not going to happen in that way. They have to add enough protein and essential fat so that the hunger will be little subtle, then they will have good muscle gain, and then they will start losing weight. So rather than opting only for weight loss, we have to change the perspective. We have to go for fat loss. That will help us to rectify hormonal imbalance.
So I have a question for Avanti. It's great that you should induce them for the muscle, for the high protein diet, for the weight loss. So the youngsters who are taking nowadays protein powders and the creatine, what is your say about that? Do you recommend that, or you should?
Okay. So, ma'am, actually, first thing is you have to eat well, start eating well. That is the main practice we need to opt for. Supplement, as the name says, it is complementary to the food. It is not going to tell you, ki, okay, stop having food and go for only powder that will fulfill your needs. We have to eat well, eat well. We have to make sure that we are meeting our nutrient requirement. We are opting for good micronutrients and micronutrients together. And if there is a requirement, if still you think that you are having more fatigue after exercise, then you can choose. Again, there are different options. It is not like that you have to opt for immediately protein supplement. Okay. And about the creatine thing, creatine is basically the substance which is used for bodybuilders or for people who are into a particular format of activity where they have to show their muscles, because creatine has water affinity. It is going to retain more water. It is going to give good definition to muscles. Usually nowadays, if you see any social media, each and everyone is saying you have to start with creatine. Even you are women, you have to start with creatine. Creatine is already going to be there in the system because body is going to produce creatine phosphate system. So first thing is you have to start eating well. Make sure that you are eating all macros together. If at all it is required, then you can think about the other resources. But again, I say you can choose normal curd, you can choose protein, egg white, you can go for chicken and fish if you're a non-vegetarian. So you can choose these options. You can start adding good amount of nuts and seeds. If still there is a demand, okay, you have to take some protein supplement because your body is not able to recover fast, then you can choose.
Thank you very much. You very nicely explained that rather than going this powder form, you have to choose your diet very intelligently. Thank you to you,
Thank you.
Jigyasa.
So small, consistent, and sustainable changes, not the crash diets, are important.
Not
Now,
at all.
my next question is to Dr. Ramaya, madam. Infertility is emotionally devastating. Now, add weight stigma to that, especially for women. How does that emotional burden of infertility worsen weight gain? And will it lead to binge eating or something like that for those with that female?
Yeah, sure. So, infertility in itself can trigger a lot of, pain, shame, guilt, social isolation, identity crisis even, because a lot of women associate or they have this motherhood as their identity, right? So when conception doesn't happen naturally, then the basic thought can feel like my body is not enough, or my body has failed me, I'm not good enough. These are the thoughts that women generate. Now add weight to this picture and it really complicates the scenario, because then people come up and say, just lose some weight and you can conceive, just do this or do that. And instead of, though they are well intentioned, for the women it appears as if somebody is judging her or judging her body. And when they're already facing family pressure, there is blame, shame about their body, all of this leads to more stress. And instead of helping, because it's stressful, you end up eating more, and there is hormonal dysregulation. So it's kind of a vicious cycle that women get into, right? And so counseling really helps here, because instead of looking it as your weight and therefore you are the problem, we change the narrative to look at it as, let's see what are the factors by which we can help you and your body do its thing naturally. So we change that narrative. So counseling really helps here. And binge eating, yes, anytime there is stress, we get into this loop of emotional eating, because our emotions are not comfortable enough to self-satiate ourselves. We look at food as comfort, and the more we eat, then there is also this new emotion that comes in, which is guilt. Oh, I'm not supposed to be eating that, and now I'm eating that. So you end up wanting to comfort you from that guilt, so you end up eating more. So it's kind of a vicious cycle that you get into.
Just want to know whether are we audible clearly, because I got two messages that the volume is low. I just want to know,
No, no,
are
we are
we audible
absolutely.
clearly?
Yes,
Yes,
Manjula, we are
yes.
Okay.
absolutely
Yes, yes,
clearly
yes. Let's
audible.
continue. Fine, let's continue.
Yeah.
So compassion should be the part of treatment. My
Yeah.
next question will be for Dr. Neeraj sir. At what point do we consider metabolic or bariatric surgery before fertility treatment?
So, interestingly, there is one angle before considering bariatric or metabolic surgery is because most of the patients I get referred from our infertility specialists is their target is to achieve weight loss in the range of around 10 to 15 kgs. So, before considering bariatric or metabolic surgery, a quicker and effective solution is gastric balloon, endoscopic gastric balloon, or Allurion swallowable gastric pill are two very effective tools which can achieve 10 to 15 kg of weight loss and can make the cycles ovulatory in patients who are aiming to lose 10 to 15 kgs. Bariatric surgery is considered in patients uh, who are having excess weight to their ideal weight more than 25 kgs and are not able to lose weight by conventional methods of weight loss. So, Neeraj, I would like to, ask here for the general population to understand, when they say bariatric surgery, we exactly don't know what does it exactly mean. What do we do exactly when we are doing an bariatric surgery? So there are different types of surgeries which are done. Someone are reversible, someone are irreversible. Someone, as you said, balloon, gastric balloon that could be deflated probably, and so it could be a temporary one, right? So just if you can narrate the different categories of surgeries which are performed and what kind of patients should go for what kind of surgery. So it will be difficult to make generalization, but the choice of procedure depends upon the targeted weight loss and the associated comorbidities a patient has. So in patients where the targeted weight loss is 10 to 15 kgs, either endoscopic or swallow pill gastric balloon is a very effective tool. In patients who have excess weight of more than 25 to 30 kgs, we can consider bariatric surgery in the form of either a sleeve gastrectomy or a gastric bypass based on patient's profile and patient's history. Now, these are the procedures. When we consider surgical procedures, a lot of patients consider them as conventional or open surgeries, whereas these procedures are very regularly done today by either laparoscopy or by robotics.
So patients' hospitalization is only for 2 to 3 days. Their recovery is quick. They start walking on the day of surgery. But one important caveat which we tell all these patients who undergo bariatric surgery for infertility is that they should not become pregnant for a period of at least a year after the bariatric treatment, because our ultimate goal of achieving or doing bariatric treatment is to achieve weight loss, and pregnancy is a weight gaining phenomena. So usually we tell our patients or sensitize our patients to uh, defer pregnancy for at least a period of 9 months to 1 year, so that they can achieve a stable weight, after which an pregnancy can be planned, and then it becomes a sustainable outcome of the pregnancy. There are a lot of options in the specifics of the surgery, but the choice of a procedure depends on a patient's profile. So we go through a lot of details of the patients and the associated challenges the patients have, like whether the patient has acidity, whether any is there any history of tobacco consumption in the patient, whether the patient is a vegetarian patient or a non-vegetarian patient, and based on all multiple factors and histories, exact surgeries planned. Our inclination these days is more towards reversible procedure than a non-reversible procedure, because it is very assuring to the patient when we consider a reversible bariatric procedure, and that gives us a very good outcome after the surgery.
Thank you, Neeraj. I would also like you to answer one more question, but maybe in the next session when it comes to obesity and pregnancy. Because when you say the obesity surgery and pregnancy, even after 1 year, if she gets pregnant, what effects this particular surgery is going to have on the pregnancy? Because there are quite a lot of absorption issues which are there when we undergo such kind of procedures. So what impact that does that have? I would like to answer you that question along with Parag sir when it comes to that section. Over to you, Jigas.
Thank you, sir, for clarifying. And what we are hearing clearly is this: infertility is not just reproductive issue; it is metabolic, hormonal, emotional, and treatable. And sometimes improving health improves fertility. Now, I'd like my next moderator to carry on with the next session. I'd like to invite
Uh,
Dr. Manjula ma'am for the next session.
Hello, sir. I would like to call upon Dr. Parat, sir. So, in your long years of experience as an obstetrician, you might have come across so many obese pregnant ladies come to you. And may I know what are the risks that you have come across with these obese pregnant women?
Okay, Manjula, the risk starts in the first trimester itself because, as I mentioned earlier, these are the women who are likely to miscarry, especially in the first 3 months. So, that is one challenge in the first trimester. Later on, we have to remember that these women tend to put on a lot of weight. So, we really have to have a nutritionist on board, and we have to be very strict as far as the diet is concerned, because it is observed that women who are obese are likely to gain more weight during a course of pregnancy. There are two medical conditions which we are always worried about, and the one is preeclampsia, that is high blood pressure, and many a times obese women land up with high blood pressure. And the second challenge which we in India are facing, and I'm sure Srirang will also endorse that, is the hyperglycemia of pregnancy. That is increased sugars in pregnancy. So typically, we obstetricians tend to do a test called DIPSI test in all 3 trimesters to diagnose it. And the moment we see that the woman has hyperglycemia, so we either have uh, the nutritionist on board, and we then refer many a times to endocrinologist to get control of the sugar. We also have to counsel our women because, in general, there is an increased risk of prematurity. So, preterm birth is something which is very common uh, in women who are obese. We also have to make women aware that there is increased chances of stillbirths or intrauterine fetal demise. That is something which is
Sudden
really common.
IUDs.
Delivering these women is at times a nightmare because most of the times the babies are big, and if you are attempting a vaginal birth, then it is difficult because it can lead to an operative delivery like a forceps delivery or a vacuum delivery. Sometimes if the baby is really big, then the shoulders get stuck in the birth canal, and then you are really in a soup because then it causes a lot of health issues.
I request everybody
Others,
else
please
to
mute.
please mute.
Others, please mute.
Dr. Nagamadi
Other than
is
speaker,
making lot of
please
noise.
mute.
Yeah. And if you're doing a C-section, especially in women who have a lot of fat over the abdomen, surgery becomes challenging. We, of course, need some extra hands to uh, assist us for that. Difficulty is there in approaching the lower uterine segment, delivering the baby. All of us know that these are the women who would land up in something called postpartum hemorrhage. So there's little extra bleeding that takes place after the childbirth. Uh, because of obesity, women are more prone for getting something called a puerperal sepsis or infection of the wound or infection of the uterine inner lining. That is called endometritis. The obesity challenges continue even after the childbirth because many a times these women lot of challenges with breastfeeding, and there is failure of breastfeeding in these women. Of course, since these babies are big, again, their breastfeeding has to be monitored properly, and we have to ensure that babies also don't face challenges because typically it is seen that babies who are obese, who have hyperglycemia, then they do get something called neonatal jaundice much easily. So all in all, the pregnancy is not easy. One more thing which I must mention is about the birth defects, because typically, if the sugars are not well controlled in an obese woman, then she's more likely to develop birth defects in the baby. So, pregnancy is a big challenge for the patient and as well as the obstetrician, but then multidisciplinary management is something which is important because everybody who's sitting here on board, of course, except Neeraj in pregnancy, have to be on board to talk to the patient and her family so that she sails smoothly through pregnancy.
Thank you, Parag sir, for that elaborative explanation on the risk that we come across from first trimester to third trimester and intrapartum, postpartum. That is very well explained. Now, I would like to move on to Srirang sir. Sir, we are coming across gestational diabetes in pregnancy. The incidence is also more and more, and handling them and the complications are also more and more. Can you give a light on this?
Gestational diabetes is typically defined as diabetes that is diagnosed for the first time during pregnancy. And classical gestational diabetes usually begins from the 6th month of pregnancy onwards. But very often we find that previously undetected diabetes gets uncovered right in the beginning of the pregnancy, which is not classical gestational diabetes, but actually the common variety type 2 diabetes, which went undetected. Now we are discussing obesity, and repeatedly the word insulin resistance is mentioned. So obesity, of course, whether you're pregnant or not pregnant, obesity is going to be associated with insulin resistance, and that is going to lead to an increased risk of high blood glucose. But obesity is not the only cause of insulin resistance. Typically, in a woman's life, there are three phases when she would physiologically also face times of increased insulin resistance. One is adolescence or puberty, the second is pregnancy, and the third is menopause. So pregnancy is one condition which is in addition, over and above obesity, associated with insulin resistance. The point being the body wants to divert all the glucose to the growing baby, and therefore you get insulin resistance during the pregnancy. Also, the placenta is producing certain hormones which are acting against the insulin, leading to worsening of the insulin resistance. So pregnancy in an obese woman, is like a double whammy, as far as insulin resistance is concerned, and that is going to lead to increased risk of gestational diabetes. Now, this is not something limited to pregnancy alone. Gestational diabetes or previously undetected type 2 diabetes in pregnancy would be associated with larger babies, with birth complications, but not just that. It is associated with increased risk of permanent type 2 diabetes in that woman in later life, and also increased risk of obesity and diabetes in the offspring of such mothers. And therefore, gestational diabetes is something which can affect not just the present pregnancy, but in fact, the woman later on in her life, and in fact, the offspring as well. Therefore, it is so very important.
Thank you so much, sir. Now, I would like to ask Dr. Avanti, even though the woman is obese, people will tell you are having two lines, one for yourself and another for the baby. They will tell that you have to eat for the two. Is that true that they should supposed to eat for two, or it is just a myth?
No, it is just
Dr.
a
Avanti.
yeah, it is just a myth that they have to eat for two people. Actually, they have to focus on baby's good growth. But while thinking about growth, they shouldn't overeat because that will lead to high fat generation, high fat deposition, or again insulin resistance. So the focus should be on eating right fiber, because most of the time, women who are pregnant, they do have lot of constipation issue that will lead to piles later on. So they have to keep an eye on their fiber intake. Hydration is one of the neglected factor I have seen. They have to make sure that they are having good amount of water in a day, because if there is a less water, they will feel more hungry often. So the hydration part plays a vital role, and protein intake. Most of the times, women who are pregnant, they opt for carbohydrate rich foods all the time. All the choices are about having carbs more. So rather than going for carbs, like suppose they're having lunch or dinner, they will choose more amount of chapatis or more amount of rice. Instead of that, they can increase the portion size of vegetables and salads or soups which are unstrained, and they can double the amount of protein like dal, legumes, pulses, chicken or egg white. Plus they can add some bowl of curd or buttermilk, whatever is convenient. And in between, whenever they feel hungry, because usually again the thought is always in their mind that they are pregnant, so they have to keep on eating all the time. So in between meals, they can choose for seasonal fruits, which are again fruit, not as a fruit juice. They have to chew well. The fiber should be consumed so that it will help them to maintain their sugars. Along with the fruits, they should add good amount of nuts and seeds. So nuts and seeds, again, raw, non-salted, non-roasted, so that excessive salt intake we can control. And mixture of seeds will again help to maintain sugar for long. So these are the tips they can use it.
Along with high fiber and high protein and hydration, do you also give suggestion on any of the exercises? Because again, movement of the body is also important.
Yeah, actually, in our clinic only with Dr. Kanpule sir, we have started a program which is related with physical activity, psychological activity, nutrition. So everything we have considered. So I think every woman who is pregnant, she has to go for exercises that will help her for breathing and some movement, so that the sugar level will get maintained and there'll be no high and low blood sugar level episodes. So exercise is again very important, unless and until it is guided by obstetrician or gynec ki they are not supposed to move. So it is again must.
Thank you, Dr. Avanti. Now I would like to ask Dr. Ramya. Already the obese woman has become pregnant and she feels that her body image after the pregnancy is going to be affected. How to cope up with this? How to guide them? How to advise them? Dr. Ramya?
Yeah, sorry. So, pregnancy and motherhood really complicates. It's a very psychologically intense phase for any women, because a lot of rapid body changes that happens, right? You have suddenly increase in weight, there are stretch marks, acne. Uh, you feel a lot of changes in your body, and you suddenly feel, women feel this loss of familiar body type. I used to look in a certain way. I used to feel a certain way about my body, and suddenly I don't have that. And you add the social media culture of having a perfect body, perfect bump. You will find the slim women just having a round bump. That's the prototype that is being projected, and women get really low when they compare themselves to that, and they would also want to immediately bounce back to their pre-pregnancy weight because they're following some celebrity on social media. So we really understand that every body, every birth, every delivery is very, very different. So I would always suggest couples, not just the women, the couple, to start counseling and to start basically educating themselves on how can they prepare for this whole new avatar of being a parent. And especially for the women, it becomes, I've had clients who would come and say, after the baby is born, imagine a couple, a mother and a father, and for the father nothing much has changed except that he has become a father, but for the women it's like everything has changed, right? And then she looks at her husband and feels very resentful. Why is it that both of us are parents and there is this man who is like able to do everything that he's always been doing? He's always been going to the gym. So when you dig further, it's not even like she's angry about the husband for going to the gym, but it comes down to, oh, he is able to go whereas I am not able to go, right? So we have to there is this proverb, right, which is it takes a village to raise a child. All right. And here we are isolating the mother to do the caregiving for the child. So I always insist, as a society, as a family, as a couple, to support the mother to do her duties well. And we have to definitely normalize talking about postpartum depression, because I've had clients who would come and say, I'm feeling very grateful for the baby in my life because, this is something that we've really wanted for a long time. But I'm also at the same time feeling extremely resentful about my body, not feeling very happy in my headspace. So this is something that we have to normalize, because research finds that 1 in 5 new mothers have postpartum depression, and it's underdiagnosed, it's undertreated everywhere in India. So we have to get these discussions more common. And like Avanti was saying, we force feed the women. I've had a woman who came and said, my mother-in-law was constantly feeding me. She was always behind me, feeding me good food during my pregnancy. But once the baby was out, suddenly all focus has been taken away from the mother
On the
and
baby.
given on the baby. And add to it, there is also certain restrictions in different cultures on various foods to be given after the baby is born, right? So suddenly there is this mother who feels that, oh, so for you, was I just a baby making machine? All this time you were treating me so nicely, and suddenly all the attention has been taken away from me.
Correct.
Right? So it makes a woman feel extremely isolated. So we have to really get her whole support system in place. A happy, a well-rested mother can also easily lose her postpartum weight, right? So we have to support the mother in her parenting journey, so that it not only helps the mother, it helps the whole family and therefore the entire community.
So along with that, one more tip that we should give her, since she is already obese, not to overgain along with the pregnancy, along with her weight. She should not overgain along with the present weight. So that is one more tip we should supposed to give. Since the obesity is just not for one generation, it is going to affect the generations to come. So that is why it is very important to maintain the weight personally as well as during pregnancy and throughout. It is a lifestyle that has to be accomplished and maintained throughout the lifespan.
I just want to mention one point,
Yes,
Manjula, that the ladies still they are coming. That during pregnancy, my mother-in-law says that drink a glass of glass of
With
ghee,
milk.
that the baby will slip on it. But it's very
And
difficult to
baby will
make them
become,
understand that this doesn't happen. Both are the different tracks. So they used to take the ghee, glasses of the ghee.
yeah.
That is a thing we have to make them understand.
Thank you, panelists. That was a wonderful input. Next, I would like to call upon Jigyasa to take over the next question.
ma'am, I'll be taking the next session. It is session number 4.
Yeah, Dr. Monica.
So while obesity,
We have left another 13 minutes left. Let us go a quick call.
while obesity is often discussed in the context of women's health, it is equally important to also realize the growing impact on men. In India, we have many men who have developed central or abdominal obesity, which significantly increases the risk of what we call as the non-communicable diseases like diabetes, heart disease, fatty liver, and hormonal imbalance. Sir, Srirang sir, do we really associate the belly fat with a low testosterone? So, is there any link between a centrally obese male and infertility, or how does it impact the parameters? Is what we wanted to know.
Yeah. So testosterone is typically known as the male hormone, though of course it is present in women as well. It's 1/10 in females compared to the male levels. So the link between testosterone and obesity is actually two-way. Low testosterone itself can lead to obesity, and obesity itself can lead to low testosterone. Now we tend to think of fat tissue as being, inert, inactive, but that is not so. Fat is a very active tissue. It produces a number of hormones and enzymes. So when there is excess fat, there's an enzyme called aromatase which is produced, which converts the testosterone to estrogen, which is the so-called female hormone. So as body fat increases, more and more of testosterone will be converted to estrogen, and the value of testosterone therefore will come down. Secondly, obesity is associated with low-grade inflammation. And this low-grade inflammation in the body gives signals to the brain, and it's finally the brain that controls the testicular function. So those stimulatory signals that the brain gives to the testes are hindered because of the low-grade inflammation induced by obesity, which is why in obesity you have got low testosterone. But conversely, if you have low testosterone, you are more likely to get obese because testosterone is something that builds muscles. So if testosterone is low, then muscle will go down, fat will go up, the male person will get fatigued, and therefore there is less likely to exercise. And finally, therefore, when there is low testosterone, obviously the testicular function is twofold. One is to produce testosterone, and the other is to produce the sperms. So if testosterone is not adequately produced by the testes, then the sperm count can get hampered, and therefore you can have problems of male infertility in an obese male person.
Dr. Neeraj, the next question is yes, sir, Parag sir, please.
Yeah, just to wanted to add something to what Sriranga said. There are studies where weight loss in males was found to be associated with improving the sperm count. So I think that should be an important counseling point for us OBGYNs when a couple comes to us seeking fertility.
Point well taken, sir. Dr. Neeraj sir, do you see more of men coming to your OPD who seek surgery? And how do you think the outcome is different in a woman versus a male compared to various bariatric procedures?
So I have to answer two questions. I have to answer question which was asked by Dr. Chaitanya also, that
Yes.
patients who have undergone bariatric surgery, is their pregnancy care is different, and the answer is no. The key elements to observe in any patient who has undergone bariatric surgery is monitoring their micronutrients and proteins. If their micronutrients like B12, D3, and protein levels are normal, they can continue to have their regular diet and supplements, and their pregnancy can definitely be normal. We have a lot of patients who have undergone bariatric surgery and have become pregnant after bariatric surgery and have delivered normal babies, uh, have even delivered normally also. Now, coming to your question, in fact, the number of patients who consult us for weight loss and bariatric surgery, the ratio of women versus men, the ratio of women is more compared to men. This probably correlates somewhere to lack of physical activity in women from their early days of life, and their excessive engagement in all family activities all throughout their life. And at some point of time, they start realizing that they have never given proper attention to their own health. So I must appreciate and congratulate Foxy for creating this awareness among women that they have to give at least 1 hour of the day for their own self and their own health. If you see, if you compare male versus females, males are very active in their overall life, and as it was rightly mentioned earlier, that there is not much difference which happens to their life even if their wife uh, is undergoing a pregnancy. So their fitness and their day to day routine continues. So it is more challenging for women to lose weight after the pregnancy. So, in our consultations, male as well as female both come for weight loss consultation. In fact, males are little reluctant to undergo bariatric surgery, akin to they being sometimes the sole bread earner. They feel that what if something happens to them, what will happen to their family? And we have to assure them that bariatric surgery is as safe as any other surgery these days, like even gallbladder and hernia surgery. And in fact, the quality of life after bariatric surgery in them will be significantly better. We have cases where patients have undergone bariatric surgery for male infertility, and their sperm counts have normalized after bariatric surgery, and the couple have become pregnant after bariatric surgery of a male partner also.
Thank you. Continuing your thought, Ramya ma'am, why do you think men avoid seeking help in these cases? And what is the stigma that is usually around discussing weight of a male patient?
It comes down to the idea of masculinity that we have defined, right? Men are always thought to be this strong problem solvers, cannot be weak, cannot complain, cannot need help. And also, this talking about bodily issues is considered unmanly in our society, right? So they might joke about it, they might avoid it. Several men don't even go for checkups, until unless it's really severe, the symptoms are really severe. Or even if men get together for a social gathering, you would find men talk about politics. They'll talk about the state of the roads, the government, the movies, but hardly you would find men talking about or discussing their problems, right? Even the rhetoric how we use always treated with I'm fine. How many of us even pause to think, how am I really doing right this moment, right? It's always met with a must tell, right? Life is good. Even underneath, you might be having several issues. So men definitely are hesitant in seeking help because of this narrative around masculinity, because they feel that, oh, how can I seek help? How can I need help? Because then it makes me vulnerable, and any position of vulnerability is looked down as weakness instead of strength. So we have to redefine this whole reaching out for help as an act of courage and not as an act of weakness. So we have to start there. Yes, there are men who are coming up, but we still, I think, are a long way from, there.
In fact, I will add just a small point here. In my practice, I have observed that women are more decisive and stronger emotionally compared to men. And although men act as machos, when it comes to taking such decisions of surgery, they are always reluctant and fearful compared to women.
Absolutely.
Ultimately, woman has to become pregnant, and it is most of the time the family, all the time the responsibility of the woman is to become pregnant. It is most of the time it is on her shoulders. So it is always she is the first one to seek for the help.
Let's move forward in this segment. Dr. Ms. Avanti, do you think the lifestyle that most of the males have with alcohol parties or late night eating, does that actually, the eating patterns, does that really make a difference in how the weight is maintained or how the weight comes back?
Actually, yeah, absolutely. Because if you're getting calories from liquids, I think those are the liquid substances which are going to provide us simple calories, and those calories will get converted into fat. So you have to be little mindful about choosing calories. But I'm not going to say ki stop having alcohol because people might not like it. But I'll say whenever you're going
You
out.
can say if you feel so. That's fine. People may think whatever they
Correct. Because
Yeah,
if it is going to affect the baby, then definitely both
I
men and women will listen.
Yeah, I do feel that if you can restrict alcohol, because then those are the simple calories. If we restrict right now, that will help us to control excessive fat gain. So first thing is that, but again, if people want to see that, okay, they can have one or two drink. So a few tips I would like to share. First thing is they're
Indian,
not supposed.
ma'am, Indian females are even they take teas too much. They take every half an hour they take a cup of tea. That is also a liquid calorie which they are taking every
Yes.
day.
Is as good as an addiction, ma'am.
Yes,
Addiction.
yes, absolutely. So if someone wants to go ahead with alcohol, they are not supposed to go empty stomach. First thing, so they have to eat something which is dense in protein before going for any kind of drink. Either they can choose chicken or egg white, and the stomach should be full. And there is another simple formula, like one drink. After one drink, they have to have 2 glasses of water. So that should be the ratio. Like if you want to have, and you have to limit your peg size. Like suppose you want to have 3 pegs, you can limit it to 1.5 peg. So I usually ask my patients, say instead of having 60 ml one peg, you reduce it to 30 ml, have 2 glasses of water, again 30 ml. So in case of mental health, mental state, you feel ki you still had 2 drinks, the quantity is less. And if they want to eat along with your drink, they should go for something which is again dense in protein. So egg white is a good option. They can choose that. They can choose a salad which is like kind of just a raw salad, just with lemon, no salt added. So rather than going for salad which has got some dressing, just plain raw salad with little lemon. It's a good option along with your drink if you want. Then otherwise you can have chicken or fish in grilled form or tandoori form, so that you will not eat which is called as chakna, which is fried with lots of fat and lots of salt.
So
Also, I will have
go
to like to add one
to
small
go
point
to
here.
go ahead with Neeraj. All said and done, this is a awareness program which is going live for all the general public. So I would again reiterate that alcohol is not good
Not
for your
recommend.
and has to be avoided absolutely. So
Very good.
rest all are
Both smoking and alcohol has to
via
be
via media,
avoided.
पावाट म्हणतो आपण तसं आहे, but avoid it absolutely.
And what I wanted to
Correct.
add is not only alcohol, all kind of liquids, because these days we
Substance.
get canned juices. I see a lot of people consuming fruit juices instead of fruits, and that is a empty calories also.
Yeah. So no liquids.
So all tinned, canned, processed
The energy drinks also.
should be avoided.
Should be avoided.
Absolutely. So if we if we go out with our family, my children, we are ordering for lime juice, and they are ordering for diet coke or coke which are tinned again. So that's the difference. Which, as you said, should not be the case. Fresh juices should be the norm rather than tinned or canned juices.
Fresh
Fresh
fruits,
fruits.
sir. As per Avanti, fresh fruits, more of fiber, less of sugar.
Yes.
So that should be.
And again for
Sugarless juices,
yeah, I would
rather.
like to add one more point. Like whoever wants to maintain their weight, whoever wants to have a good body composition, even sitting for longer duration is not recommended. Suppose you are very busy, very occupied, make sure that you are getting in between, like even during OPDs also, like you have to get up during meetings, during presentations, get up, walk, take a call on while walking. It is always better, because if you're sitting for more than 2 to 3 hours, it is equivalent to smoking one cigarette. So we have to change that pattern. Now, I usually ask my patients to have a half a glass of water every hour, so they can then they go for loo, and that will add on some steps. So this is a simple tip they can opt for.
Thank you, Ms. Avanti. So I would now request Dr. Jigyasa to please carry the next segment.
Can we continue? It is already 6:30.
Yes, ma'am.
Yeah.
Yes, ma'am.
Monica, can we continue?
Yes, sir, we can.
Because we have lost 10-15
Yeah.
minutes.
10-15
Yes,
minutes, we
yes,
can
yes.
continue, sir.
We can.
Yes.
Dr. Jigyasa, please take over.
Next
just
session is on perimenopausal weight gain. Doctor, I didn't change anything. The same diet, the same routine, but I gained belly fat. This is the most common complaint in the perimenopausal clinic. So my first question will be to Dr. Srirang sir. What hormonal shift happens in the perimenopause? Why does fat move more towards the abdomen, and is metabolism actually slowing down?
Yeah, so menopause is a very important transition phase in a woman's life. And that is the time when the ovaries stop functioning. And the major hormone of the ovary is estrogen. So estrogen levels gradually decline around the time of menopause, and then they just, decline very sharply after menopause. But estrogen is not just a reproductive hormone. It plays a very important role in metabolism, in fat distribution, in insulin sensitivity, and overall vascular health. So when you have menopause, there is a redistribution of fat. The fat, which was previously more around the hips and the thighs, starts moving around the abdomen or the waist. And this type of central fat is extremely dangerous. It is metabolically active and it promotes insulin resistance. And because of insulin resistance, which worsens after menopause, such women are at a high chance of getting, pre-diabetes or frank diabetes or abnormal, fat levels in the blood. What also happens, as you alluded to, there's a drop in the muscle mass. So fat increases, muscle mass decreases, and actually the basal metabolic rate, the expenditure of calories, that becomes efficient, so less calories are spent in doing the same thing. And finally, menopause is associated with sleep disturbances, mood disturbances, and stress. And therefore, that can promote eating and that can further promote, aggravate weight gain and this sort of metabolic imbalance. Now, prior to menopause, women seem to have this natural protection against cardiovascular disease compared to men. So you never find young menstruating women usually getting heart attacks or strokes. But that protection which nature has offered to a menstruating woman is lost after menopause, and the cardiovascular risk therefore equals that of a male. So all these important metabolic, hormonal, cardiovascular changes are occurring during menopause.
So estrogen drops, muscle mass declines, insulin resistance increases, and body stores more central fat. That is what happens in perimenopause period. And it is a metabolic adaptation, not just aging. My next question is to Dr. Parag, sir. What are the most common perimenopausal complaints you see in your OPD? Weight gain, sleep issues, or mood swings? And how much hormonal versus lifestyle are these?
Okay. Uh, Technically, if you see in obese women, we expect the estrogens to be produced in little higher quantities. But then women who are obese and in their perimenopause do suffer from hot flushes, mood swings, etc., typically seen as a part of estrogen deficiency. And of course, what Dr. Godbole has mentioned is absolutely right. So these are the women who land up with so many metabolic issues and generally they are attributable to the lifestyle that they are following. So again, here comes the multidisciplinary management where we talk to them, encourage them, because many a times they do have challenges with sleep, they do have challenges with their uh, moods, or even they are too anxious as far as the perimenopausal phase is concerned. So a good counseling and reassuring them is extremely important in this.
Yes, sir, you have to unmute yourself.
Thank you, sir. So women just not only fight obesity, they are also fighting the biology. Now, my next question is to Dr. Avanti, madam. What is the biggest mistake women make in their 40s? Is eating less is the answer? And how important is protein and strength training at this stage? Avanti,
Please
madam.
unmute. Please unmute, Avanti.
So sorry. Okay. Okay. So weight training is must during perimenopausal stage because otherwise they will have osteoporosis in later life. So immediately as and when you enter 40s, start with weight training. That will help us to reduce your visceral fat. You will build more muscles. Your BMR will go up, and you will have a healthy fat loss. and you will feel happy about it. And second thing is, most of the times female do have omega 3 deficiency, magnesium deficiency, selenium deficiency. So to overcome these deficiencies, because magnesium is a very crucial element or mineral which is important for sleep also, and about mental health also. So they should have good focus on eating foods which are going to provide them good amount of micronutrients, especially selenium, zinc, magnesium. So all the nuts and seeds, green leafy vegetables will give us good quality of these micronutrients. So at least one portion in a day is recommended to fight this. And phytoestrogen rich food like soya bean or flax seeds, they should add that to again help us to maintain the hormonal imbalance.
So after 40, the goal should not be eat less, it should be preserve muscles.
Yes, preserve muscle. Focus should be on preserving muscles. Like it, the weight training should be like how we breathe.
Do you encourage HRT for the postmenopausal women? Because estrogen is going to protect cardia, muscle, bone.
Yes, I do. So 2 to 3 times they should go for this kind of techniques. Otherwise, they can see there are three major components of fitness. First is flexibility, second is cardiopulmonary strengthening, and muscle strength and muscle endurance. One should always focus on muscle strength, because if they have good muscle strength, they can definitely look after other things. And when we are thinking about training of a particular sport or any particular exercise routine, it is going to improve your joint mobility, your strengthening, your endurance, and mental health. So it is must.
What about hormone replacement therapy, HRT?
So
HR,
Manjula, hormone
I think
therapy.
sir will speak
Yeah,
about.
yeah, yeah.
Okay, fine, fine,
So
fine.
hormone therapy per se will not be the first option in these women, if because if they have so many comorbidities, we would certainly like to avoid oral estrogens. If at all, if we have to give, we should give transdermal estrogens, which are a little more friendly with the liver as well as with the uh, thromboembolism. But then that is again kept as a second line. If there's no benefit with the lifestyle modification, with the counseling,
Okay,
then of course you can consider in select patients.
Uh,
thank you, sir.
Next question is to Dr. Ramaya, madam. This phase is emotionally intense, children growing up, career pressures, aging parents. Is midlife a body image crisis? Or how do hormonal shift affect emotional eating?
Yeah, thank you. So, this is, I call it the sandwich generation, where you're also caring for your younger generation, you're also caring for the older generation. And in the never-ending to-do list, myself comes at the end, right? So, even if women are, they find it very hard to take time out in their busy schedules to prioritize themselves and go for the gym, to do some weights, or to even concentrate on their diet. So, that's number one. Number two is we all end up into this trap of all or nothing. So imagine, there's this extreme tendency to go on restrictive diets. You suddenly get up and make up your mind that, no, 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 I have to do this, I have to do that, I have to do this. And then, you're able to follow that for 4 days, and fifth day, because it's so restrictive, you're not able to follow that. One thing slips and then guilt sets in, and you feel like, okay, anyway I was not able to do it, let me just go back, let me abandon my health plan, I'll go back to where I was, right? So this all or nothing approach has to be stopped, and we have to really find a midway where we feel like, okay, one day I'm not able to go, it's okay, I can forgive myself, and it should be about how soon can I get back to my health plan. That's the second thing. And thirdly, I would also suggest to women, if they are constantly, having a plan and are consistently not able to stick to it, it is also wise to look at any subconscious emotional triggers or blockages that they might have, because we see this in practice all the time. You are consciously having good intentions about getting into good health, but there are subconscious, we call this core wounds in psychology, which is like, I'm not worthy enough, I'm not good enough, I'm not lovable enough. These are core wounds that women have at a subconscious level, and sometimes they might end up self-sabotaging their own plans that they make at a conscious level. So it's also important, if you feel like, if women feel they're not able to consistently keep up to a schedule, and they're always gaining weight despite their best bestest efforts, I would suggest talking to a counselor, because then you can clear out any emotional blockages that you might have.
So this is
Can
not just
laziness be one of the reason?
Sorry?
Laziness? Being
Laziness.
lazy?
Uh, See, you could look at it as laziness as an outside way, but internally it is not laziness. You have done so much. There's so much of, in today's hustle culture, you're getting overstimulated so much so that your nervous system is always on that fight flight mode, right? And one day you feel like, okay, let me just rest. So it's not even laziness that I would call it. It is like your nervous system saying, okay, reset, give me some time to process all that's happened during the week.
so it is not just menopause, it is identity transition.
Yeah,
Now,
yes.
now I like to ask question to Dr. Neeraj sir. Neeraj sir, if you are available. Uh, is 45, 50 too late for metabolic surgery, or do outcomes differ at this age?
No, outcomes of metabolic surgery are directly related to the lifestyle modifications which patient follow after the surgery. The age indications for doing a metabolic surgery start from 18 years and extend up to fitness of a patient, because age is basically a chronological number. If the patient is fit, we have done bariatric surgery even at the age of 80 also. Uh, so there is no age restriction as such, and outcomes do not change much irrespective of whether what is the patient age.
Thank you, sir. Perimenopause is not the beginning of decline. It can be beginning of metabolic awareness. Strength training, protein intake, sleep, stress control, medical guidance when needed. Midlife is not too late to reset health. And this matters because abdominal obesity after menopause increases long-term disease risk. I now hand over the session to Dr. Manjula Madam to carry on further.
Dr. Jagesa ma'am, we are falling short of time, so we will start with two important questions first. We need to know from Dr. Srirang sir about the latest drugs which are anti-obesity, the GLP-1, the semaglutide, Mounjaro. If you could highlight the side effects and who are the patients who will benefit from most from it. And we also need an answer to a question: why does weight always come back? This answer
Srirang sir.
we need from everybody. So, sir, if you could please.
So
Yeah.
basically, there are two excellent drugs available today for the treatment of obesity. One is called the semaglutide, and the other is called tirzepatide. Now, once we have accepted that obesity is a disease, not only is it a disease, but it's the mother of diseases. Just like we accept pharmacotherapy for diabetes, hypertension, so on and so forth, it's high time we realize that obesity needs pharmacotherapy. Because with the best of lifestyle modification, studies have shown that first of all, lifestyle modification is difficult to sustain, and generally you are unable to maintain a weight loss of beyond 5%. I'm talking of maintenance, not of losing weight. So on the one hand, you have a 5% weight loss at the maximum with lifestyle modification. On the other spectrum, you have metabolic surgery, which can cause a weight loss from upwards of 25% to 40%. But you have a large chunk of patients in between who need a weight loss of somewhere between 5% to 25%, and that is where the pharmacotherapy fits in. And in fact, it is very often used by surgeons even before they do a metabolic surgery and even post surgery, because as I will answer later on, weight will inevitably come back even after bariatric surgery to some extent. So we need to, first of all, identify the right patient for pharmacotherapy. And there are clear-cut labels. They can either be used for type 2 diabetes per se to control the diabetes, to reduce the risk of cardiovascular disease, to reduce the rate of decline of kidney functions in people with type 2 diabetes, or they can be used simply in obesity if there are other comorbidities depending on the type of weight, so the degree of weight. So the important thing is patient selection. Important thing is counseling before you start such therapies. And I must say that these are revolutionary medicines. They ought to be used fairly, extensively in our patients, those who deserve them. And of course, you have to monitor the patient for adverse events, which mostly are gastrointestinal, transient, and which usually disappear when the drugs are continued. The important thing is to continue the drug and not stop them, hoping that just taking the drugs for a short period of time is going to cause indefinite weight loss. Now, as far as pregnancy and thing is concerned, because there was a question in the chat box, you need to stop semaglutide for 2 months prior to the time you want to try for conception. You need to stop tirzepatide for 1 month prior to the time you want to start trying for conception. Remember, if you're a woman who has irregular cycles, irregular ovulation, and you're on such drugs, chances are that you will ovulate now because your weight has come down, and therefore you might land up with an unwanted pregnancy. So contraception is very important in those women who do not seek a pregnancy and if they're on such drugs. But these are excellent drugs and they should be used properly, judiciously, and in the right patients. Why weight comes back? Yes, our bodies are built to gain weight. Our bodies are not built to lose weight. When we make attempts to lose weight, the body perceives as if there's a threat to survival. Our body is built to fight famine. It is not built to fight, times of plenty. So when you start trying to lose weight, there are some compensatory hormonal mechanisms. The hunger producing hormones start going up and the satiety hormones start going down after the surgery or after any attempt at weight loss. And therefore the person starts craving for food, and the resting metabolic rate also changes after you make attempts to weight loss. And therefore, beyond a certain point, the body will resist all attempts to lose further weight, and it will in fact try to take you back to your weight set point, which always seems to go high and never seems to come down. So that is why we will always gain weight. It's not because of lack of willpower on part of the patient. So no need to blame the person who fails to maintain weight. This is what happens to everyone. So weight regain is the rule. Maintenance of weight loss is an exception.
Absolutely, you said it. You nailed it, sir.
Sir, these drugs don't they cause muscle loss?
No, the proportion, see, if you're going to lose, body weight, you're going to lose some muscle as well. You're also going to lose some hair as well. So you'll also have hair loss. Okay. But if you look at the proportion of fat mass lost versus the lean mass, that proportion is in favor of the lean mass. So the proportion of lean mass actually increases in proportion to the fat mass loss. And in fact, there have been studies, especially on semaglutide, where muscle function actually improves, as evidenced by the hand grip test, which was done in those studies. Muscle function actually improves when you take drugs like semaglutide or tirzepatide for that matter.
Along with that, don't you advise exercises
Madam,
to
please
maintain the
understand.
muscle mass?
No, yeah. So exercise, particularly resistance exercises, are important because
Yeah,
you might lose a little muscle, come what may. So resistance exercises are
will
particularly
regain the muscle
important for
mass.
people who are, undergoing this type of pharmacotherapy.
Dr. Neeraj sir, do you also see weight coming back after bariatric procedures and in how many proportion of patients?
Absolutely. As rightly pointed by Srirang sir, weight regain after any weight loss intervention is physiological. That's why the key in maintaining weight after bariatric surgery is in maintaining, offering a great support to the patients who have undergone bariatric surgery. We need to take regular follow up with them and help them at a point where they realize that they are regaining weight in their journey of weight loss. The positive aspect of gaining weight after bariatric surgery is that once they gain weight, and if that is recognized early, we still can take them back to their earlier lost weight where they were. And as mentioned by Srirang sir, use of these new drugs in adjunct after bariatric surgery has also helped us in keeping them their weight at a lower matrix.
And how long are these drugs effective and safe?
They should be used. They should not be stopped unless there's a contraindication that is developed. Only then should you stop. But if you ask me physiologically, they need to be continued indefinitely, unless, of course, a woman wants to conceive. That's a different matter. That's a contraindication. But otherwise, for benefit, you will continue to gain benefit, not just for weight, but also for the risk of heart attacks, risk of stroke, for the risk of fatty liver, for the risk of all-cause mortality. All these things have been proved in clinical trials that they have long-term benefits. So you should not hesitate to use them continuously. Do not stop them.
Sir, I call them as new generational insulins. As any diabetic patient goes on insulin, once they go on, they should continue taking it.
Absolutely, absolutely. See,
The message is loud and
nobody
clear.
asked this question for a statin, How long should one use a statin? How long one should use an aspirin? We only seem to ask such a question for tirzepatide and semaglutide.
So are there some new drugs in the pipeline which are going to be more beneficial than semaglutide, like in terms of gaining muscles and something like that?
Yeah. There are many good drugs in the pipeline. The problem with anti-obesity drugs historically has been their adverse effects, and very often they had to be withdrawn historically because of unexpected side effects. Now, these are two drugs which have withstood, that challenge of not getting adverse effects, which need a discontinuation or withdrawal of that drug. So there are good drugs in the pipeline, but unless they come to the market after a rigorous clinical trial program and a post-marketing surveillance, we have to keep our fingers crossed. But there will be good drugs, hopefully, in the future.
Very nice.
That will be an easy way out.
Sorry?
That will be an easy way out for obesity.
But that is what is needed. You can't have difficult answers to difficult problems like obesity. How can we expect an easy answer to obesity when it is multifaceted? You cannot have easy answers to difficult questions.
Sir, should we not promote exercise and lifestyle in these patients?
Yeah, but
That is always advised.
that is recommended.
That is the first line.
No, I'm not trying to belittle that importance, but what happened in the trials? People who are on lifestyle modification lost 3 to 5%, that's all. Whereas comparatively, these drugs cause a weight loss of upwards of 18% and 20%, which is what you need for modification of disease and reversal of disease. If you want to reverse sleep apnea, if you want to reverse, liver fibrosis, you cannot do with 3% and 5% of weight loss. You need 15% weight loss. That cannot be achieved by lifestyle modification. You need drugs for that. It's high time we accepted that.
So Jigyasa, it has to be that way, It depends upon how much weight loss you need to.
Correct.
And that will guide you whether only lifestyle modifications would help or it needs to be in association with these medical therapies, pharmacotherapies, which are available nowadays. So it can
Very true.
How much willpower you have.
just this or just that. It has to be a holistic approach, what we have to look for. I think we are close to 2 hours, Monica.
Yes, sir.
Yeah.
What is the one message that all our panelists want to give our audience?
Yeah, this is for all the panelists. If at all, if you want to give one single message for one habit for the families to start with, what is it? I request all of you to give your rapid fire answer.
So my takeaway would be, consider obesity as a disease. You do not blame the person affected as the culprit. The person is the victim. The obese person is not the culprit. So, empathize with them, give them respect, don't blame and shame them.
Right.
That's the thing.
Great.
Absolutely.
Dr. Neil. Yes, Avanti.
Yeah, Avanti.
Yeah. So start reading labels before buying any stuff. So if you read, you will understand the content and then you can decide whether the ingredients are good or not. Then you can choose the product.
My message will be we should focus on preventing obesity more and then consider treating obesity. Monitoring weight every day is one simple way by which early intervention in weight gain is possible, and that can definitely prevent. It is easier to lose few kgs than to lose kgs more than 20.
Parag sir?
Yeah,
we open to all the therapies. So it is a combination of everything, what Srirang has said. So it is about lifestyle modification and as and when needed therapies that are now prevalent. But definitely the woman, if she's trying for a conception, she has to be in a good health before she makes an attempt to become pregnant.
Dr. Ramya.
I have two. One, healthy living is not a sprint, it's a marathon. Two, make movement a part of your family culture.
Very good.
Super. And one more rapid fire is, what is the one message for the next generation that you would like to give? all of you. Okay, starting with Shiran sir.
If you want to prevent adult chronic disease, you have to address childhood obesity. Stop this whole thing that अभी उनकी उम्र खाने की है, उनको जो
हाँ,
खाना है खाने दो. You stop all these things and
Yes.
adopt a healthful living right from childhood, and do that by your own example. Parents should set their own example if they want their children to follow them.
perfect. Neeraj sir.
As rightly mentioned, we have to look life as a long term perspective and not as a short term sprint. So when we look at life from a long term perspective, 1 year, 1 month, few failures here and there are really of any not any relevance. And playing active sports from childhood is something which can make you really strong and get
Very important.
face failures very often and become stronger with failures. So I will strongly recommend playing any active
Sports.
individual or team sports.
Oh, okay.
Thank you, sir. Parag sir.
Yeah, a message to the youngsters, because they boast a lot about having PCOS. Now, having PCOS is not a pride. They have to control, the challenges that come up along with PCOS, because if they don't control the disease will control their health.
Thank you, sir. Dr. Avanti.
Eat local, eat seasonal. Simple.
Dr.
Very
Ramya.
Stop living in the mind and start living in the body more.
great, great, great.
Super.
I
Super,
just
super
want to add
messages.
one thing, if
Yes, ma'am.
everybody permits.
Yes, ma'am.
Sure,
There
ma'am.
is, yeah. So there is a role of nutrigenomics. It has come. So epigenetics, those, how much, I just want to have a discussion, one discussion, one panelist can answer. Have you come across the people saying, मैं कुछ नहीं खाता, सिर्फ इतना ही खाता हूँ तो भी I am obese, right?
Correct.
And some people say that I eat so much, but I am not putting on weight.
But I think there is somewhere gap between their
So no.
type of
There is a role, and I think Dr. Parag knows, and the Green Array Laboratories, they do this nutrigenomics in Pune. And have you sent your patient for nutrigenomics or
Not
testing?
really, but then that appears to be an interesting field, because that would probably give us or our patients a clue as to what they should eat and what.
They should eat. Yes.
Ma'am,
We have
actually, the
usually sent
people
our
who
patients
eat.
to nutrigenomics. I have myself done my own nutrigenomics, but we have to understand that nutrigenomics change based on environmental stimulus. So
Okay.
they cannot be taken as a black and white rule. They are guidelines for us to understand where are we coming from and what changes we can adopt, which can make our weight loss journey or weight maintenance journey helpful.
And gut microbiomes again. Whether Dr. Srirang, you prescribe these things to your patient, gut microbiome. So it is
Prebiotic, probiotics.
So there is evidence that there is a different type of gut microbiota in people who are obese, but there is no evidence that giving certain gut microbiota improves obesity. So there's nothing on the label. So I would strictly go by the label and use only drugs which have got a labeled indication.
so
None of
along
these.
with the drugs, you don't prescribe
No,
any
I don't.
gut
I don't. No.
microbiota.
I go strictly by the label.
Okay.
I think we have
Thank you very much.
come to a close of a very vibrant discussion about obesity, isn't it, Monica? We had inputs from all our stalwarts on a very important aspect. I think because of the sparsity of the time, we haven't covered all the topics. Maybe, Monica, we can think of having one more such symposium in future, wherein we
Yes,
can
sir.
rest of the topics which we couldn't cover today, Manjula. So,
Yes, sir.
and maybe have one more, a shorter version, maybe about an hour's time, which will cover the rest of the issues or problems that we couldn't cover today.
Really.
I think it's time for us to close, and for that, you are going to invite Dr. Kanchan, right?
Yes,
So
Yes, Kanchan Sharma, ma'am.
Really, this was a great, wonderful feast to all the audience. We had a wonderful discussion today with all the field specialists, especially we had endocrinologists, we have nutritionists, we have even infertility specialists, we have all the gynecologists, we have dietitian, we have psychologist. So, my thanks to all my colleague chairpersons, Dr. Monica, Chaitanya, and all the moderators who took pain. We try doing this a wonderful panel and a feast to all the audience under the leadership of our Foxy President, Dr. Bhaskar Pal and Suvarna Kadilkar Madam, and all the two VPs, Dr. Vidya Thobi Madam and Dr. Meenu Agrawal. So about obesity, I just want to mention few lines. Obesity is not merely excess weight, but endocrine imbalance within, insulin resistance rises, ovulation grows thin, PCOS deepens hair, cycles delay, fertility fails along the way, conception struggles, pregnancy fragile, loses more frequent, outcome less stable. Yet this chronic disease is not beyond control. With lifestyle correction, we restore metabolic role, balanced nutrition, movement each day, and prevention and science can lead the way. So, by these words, I again thank Dr. Shri Rang Godbole, Dr. Neeraj, Dr. Parag sir, Dr. Manjula, Dr. Avanti, and Ramya, and all the co-chairpersons. Thank you. We wish that we will be having such an important discussion again and again. My
Thank
thanks
you.
and regards
Thank
to
you.
all.
Yeah,
Thank
thank
you.
you,
Thanks.
Kanchan,
you much.
Chaitanya, Monica.
Special thank
We enjoyed the
for
session.
my special thank you for Dr. Srirang Godbole sir, Dr. Neeraj, Dr. Parag sir, Avanti, and Dr. Ramya. You said immediate yes on my one, and was a very nice and insightful. So much.
thank you all the panelists for sharing insights, which will be very useful for all the people who have joined us online. And thank you, Dr. Ramya, for chipping in at the last moment. Thank you
My
so
pleasure.
much.
Thank
My
you.
pleasure.
Monica,
Lovely meeting you.
Thank you, Foxy, for
Thank
giving
you.
us this opportunity to
And
discuss on the obesity, which is the need of the hour, and educate the common people with a platform of Endocrine Society, NCD committee, as well as Foxy Public Awareness Committee. I thank wholeheartedly for giving us this opportunity to go this discussion live. Thank you, one and all.
yeah, and the recording of today's session would be available on the YouTube Foxy official. So anyone who has missed this session, go back, listen to it anytime he or she wishes to.
thank you so
May I
much.
know what is the number of audience viewers, sir? Can we get to
So
know?
no, when it's on Facebook and YouTube, we don't get the
Only
actual.
Okay.
once we finish the recording, we will be able to see.
We will get.
Oh, okay,
So
okay, okay, okay.
we will let you know, Manjula. Don't worry.
Okay,
Okay,
Thank
sir.
you.
definitely.
Thank you, Parikshit
So
sir,
we can go
also
on.
for the technical help.
We can have discussions offline.